Hey gang, this is Dr. Leslie again. Just want to thank you guys for giving me some feedback. Some of you in regards to the scapula video I initially posted. Um, as time goes on, I'm going to be trying to like update maybe my technology and improving these. So definitely keep checking back. I'll probably post it to the Google Classroom. Uh, as I make changes or improvements with each video. The other thing is make sure you're using this mainly as a supplement. Uh, I'm trying to keep this as user friendly to and not be as robotic with the explanation. So if I omit something from the handouts for the practical exam and or lecture notes, definitely can double check my work here. But just for the fact of just trying to make this very watchable, that there's always a chance I may omit something. But for the most part, I'll have everything down. And also, if you're studying from the PowerPoints or just your own private notes or from pictures from Muscolino's book, this may be a nice break from that's the standard studying. But anyway, let me get started. I had finished up with the scapula. Unfortunately, I have a left humerus. We're going to cover the proximal humerus and the elbow. I have, as you see in the picture right now, the scapula. I wish I would have had. This is a right scapula. But remember, we talked about in the last video, this is, the glenohumeral joint and the glenoid fossa, which is going to receive the humeral head, okay? So again, this is going to be the medial side. This is going to be the lateral side, okay? So we have the humeral head here. We're going to have the anatomical neck just distal to the head. We're going to have the surgical neck down here, okay? A couple major landmarks to take notice is, and we had talked about the rotator cuff on the scapula video, is this is going to be the greater tubercle. Okay, sometimes you'll hear anatomists call it the tuberosity. That's going to receive the supraspinatus, infraspinatus, and teres minor, almost kind of where my pencil eraser is kind of going along the from anterior to posterior across the greater tubercle. On the medial side is going to be the lesser tubercle. Okay, subscapularis is going to insert in that landmark. Then in between, hopefully you can see it on the video, we covered it in class, there's this groove going between the greater tubercle and the lesser tubercle. And we call it the intertubercular sulcus, sometimes the bicipital groove, because it is going to receive the long head of the biceps. Remember, biceps being 2, there's going to be a short head. That's, again, this is the medial side, right? This is towards the torso. Remember the coracoid process here. Get in the screen here, but here's your coracoid process. Okay, so if we had a left scapula, the short head of the biceps is going to come around right where the pencil is to meet with the coracoid process, and we talk about pec minor, coracobrachialis, and small head of the biceps going to attach to that coracoid process. However, the long head of the biceps is going to run between the bicipital groove. There's going to be a transhumeral ligament that's kind of hold it. So think of it like duct tape running across, holding that tendon in place. When we have bicipital tendonitis, clients, patients are going to have some tenderness in this region. And there's like a tendinosis, tendonitis, whatever term, but that goes beyond this video. And it's going to go up to the supraglenoid tubercle and attach. And we showed you the supraglenoid tubercle on the scapula video, but I might as well show you here since I have it handy. But approximately right there, okay, where my fingertip is, and there's the coracoid process. Okay, so the long head of the biceps is going to run through that groove. Okay, on the lateral side, I'm not even going to turn it around because this is plastic, so sometimes you don't see it. It's not as prominent as the tibial tuberosity that we'll get to after the midterm, but there's the deltoid tuberosity on the side. The deltoid muscle is going to have the anterior, the middle, and the posterior. They're going to kind of come to a point at the deltoid tuberosity. Common spot for bursitis. There is a bursa there. Remember, fluid-filled sac adds from lubrication where the tendons are rubbing over bony protuberances. Also, remember our midshaft. Remember on the long bones, the the diaphysis is the longer section here. The metaphysis is closer towards the epiphyseal plate, which is this kind of groove here. And then there's the epiphysis is the further side. Now we assume this is not an adolescent, so that this growth plate would be closed. As we move further down, okay, here's the diaphysis of the bone, like I said, and we get into more of the elbow joint. Remember, it's a diarthrodial joint. It's a combination, okay, of the humeral radial joint, the humeral ulnar joint, okay, and the radial ulnar joint. Well, there'll be pronation and supination, okay, of the joint. Sorry, I'm moving the camera around here a little bit. But as we covered in class, we have the supracondylar ridge. This is going to be the medial supracondylar ridge, lateral supracondylar ridge. Okay? We're going to have the capitulum, okay, which is on the distal end of the humerus, proximal, and that's going to join with the radial head. And remember in class I talk about cap, think of cap and capitulum. With head, cap goes on your head, all right, for that side. Because on the other side, more on the medial side, it has a little more of a protrusion here, is the trochlea, which is going to meet with the ulna, which again is on the medial side of the arm. We're looking at a left arm here on the anterior side. We have the radial tuberosity, where the bicep tendon is going to attach to. Okay, this is anterior. So we've learned since grade school, the bicep kind of comes down and is going to attach here. We're also going to have brachialis deep to the bicep, worth mentioning. Okay, remember the bicep is an elbow flexor, shoulder flexor, supinator. Brachialis is mainly a elbow flexor. Okay, on the ulna side, right over here, we're going to have the coronoid process. Okay, radial head, if I haven't covered it, the radial neck, I said radial tuberosity. We're going to have the lateral epicondyle of the medial epicondyle of the humerus. We're going to have the lateral epicondyle. Okay, we're going to have these couple of fossa here. This fossa, well, let's start on the lateral side. This is fossa right here. It's going to be for the radial head. We call it the radial fossa. And for the coronoid process, the coronoid fossa. Why? Because as we flex our elbow, I'm not going to bring it all the way up. We have to have some space. Maybe I will bring it up. Okay. We need some space for the coronoid process and the radial head to kind of, be slightly recessed to allow us to get proper elbow flexion so there's not a bony block. All right. So I'm going to kind of bring it on down again. Okay. So again, we're on the lateral side. Again, here, the radius is going to be on the lateral side. We're going to know that too later because we're going to talk about being on the thumb side. All right. So the thumb, we know in anatomical position, is on the lateral side. We'll talk about this in a hand and wrist video separately, but might as well mention it now that we've got 2 phalanges. Every other finger has 3. Okay, so we know we're on the lateral side, and then the radius is kind of continuing all the way up. Okay, I'm going to flip our elbow around to the posterior side. Okay, and hopefully we'll have a nice mark here. But what we have here is we have the olecranon process on the ulna. We have the olecranon fossa for the same reason on the anterior side. When we bend our elbow, it allows a little recess for the olecranon to process to go into the posterior side of the humerus. The triceps are going to attach here on the olecranon process. All right. Again, I'm not going to be covering every single muscle here. I'm going to try to highlight some of them and just basic, terminology. Let's go to the medial epicondyle. Okay, the medial epicondyle, we have what we always talk about. There's going to be the common flexor tendon that's going to come off of here. Common condition is going to be little leaguer's elbow, golfer's elbow. Okay, we're going to have the common flexor tendon, and most of the muscles that are going to be attaching here are going to come down on the anterior side, attach into the hand and wrist, which we'll cover up those landmarks later. And most of them are going to either flex the wrist and or flex the wrist and flex the fingers. So flexor carpi radialis, flexor digitorum, profundus, flexor digitorum superficialis. We're even going to have pronator teres that's going to come around and cause pronation, okay, of the forearm. So if it's on the medial epicondyle, okay, you're going to palpate on the medial side of your arm. And if I bring my arm out here, okay, I'll try to do a little bit of everything, okay, but approximately right the side closest to the bone is the medial side of my arm. So it's not really that clear, so I'm going to kind of probably pass over this with my arm. If I had an assistant here, I'd be able to kind of pin everything down. But if you're palpating the medial side of your arm and you feel your medial epicondyle, you're going to have the common flexor group. A lot of times the muscle will pull at that area. Okay? It will kind of pull at the emphasis, which is where the muscle attaches to the bone, cause some inflammation. On the lateral side, okay, a little bit more on the posterior side, okay, we're going to have the common extensor tendon. Okay, I'm going to try to turn it on its side, but here's your lateral epicondyle, and we're going to have the common extensor tendon. These are going to go on the extensor side of the arm, okay? So if you put your hand in pronation on the back of your fingers, okay, these tendons are going to come down, all right? And if I come down to my hand and wrist and I rotate you over, okay, this is going to be on this surface of the hand. So my hand here, okay, it's going to come to this side. So those muscles are typically going to extend the fingers and extend the wrist, okay? So just something to consider. You're going to have extensor carpi radialis, brevis longus, extensor digitorum, okay? So I get that repositioned off the lateral epicondyle, all right? So if you palpate the lateral side, most likely you're going to be on an extensor group that's going to extend the wrist, extend the fingers and or the fingers. And on the medial side, you're probably going to have some flexor component in the name of the muscle. Okay? So I'm going to end the video there. I am going to do a video on the hand and wrist. Hopefully that's clear. And again, just use this as a supplement, maybe if you want to get away from your regular textbooks. Okay? Have a great day. Take care, guys.